Welcome back. We are answering your coronavirus questions with Dr. Cynthia Snyder from Cone Health. Remember, you can text your question. The number is 336-379-5775. All right, in the queue right now for questions. This person is asking, is it possible that the second strain of COVID is in the United States, because we've heard that it's in the UK?
So, many questions are coming up because of the media release with finding a new strain in the UK. Right now, we know that there has been actually mutations, and we anticipate that with any type of virus. And actually, the strain that we have in the US was different than the one that they had in parts of it can be different from China. So we don't know necessarily if it's here in the UK yet. That more importantly is that we don't think that there's a significance yet, but that still remains to be researched and looked into a little bit further. For right now, from what's been reported out of the UK, it does not seem to be more lethal or cause more hospitalizations, but I feel like that's probably too soon to tell.
Okay. This person is asking, is there people who are experiencing allergic reactions to the COVID vaccine, because I'm allergic to the flu vaccine, and is it similar, the reaction?
So what we know of the folks that have had, at least with some of the people who've received the COVID vaccine, who've had anaphylaxis side effect, and that is consistent with swelling of their throat, difficulty with breathing. In some of those patients, they've had a history of anaphylaxis based on different allergies. And so the clinical trials had excluded folks who had anaphylaxis. So we didn't have that much information. And there may be a few people that did not have history of anaphylaxis have this type of reaction. So it's still kind of this wide range of which type of allergy will put you most at risk for getting anaphylaxis from the SARS-CoV-2 vaccine. And that part is not well known. We do know many people who in healthcare who are getting vaccinated right now. They are still, they may have history of anaphylaxis and they're still going through it, but they're waiting a little bit. They're waiting a longer period of time during observations after getting the vaccine. And a lot of them are also taking what's called pre-medication with Benadryl or famotidine to help minimize those risk factors. In terms of the question for flu, it depends what type of allergy you have. If you have anaphylaxis to flu vaccine, then there is a risk of getting anaphylaxis to the COVID vaccine. But if there's no preservatives in the in this Pfizer COVID vaccine, so it would be safe to take if that's the issue.
Okay. This person is asking, how do you feel about kids returning to the classroom in January?
So it really depends on which grades. I think it is really important for kids to be back in school. That structure is so important in the socialization aspects of it. I think it can be done safely. And it's really about keeping their classroom in that proper bubble and making sure that they get screened for symptoms and have easy access to testing to turn around. So I'm a fan of it. I hope we can create that structure that'll be okay, but it really depends on if our rates are continuing to get higher. There's a chance that it gets postponed.
All right, we have two questions that are kind of piggybacking on that question about the allergic reaction. Number one, does the COVID vaccine have eggs in it?
So the COVID vaccine that we have so far approved, which is the Pfizer biotech and the Moderna, do not have eggs in it.
Okay, and the second part of that is, what are the chances for those of us who have a lot of various reactions responding to different medications? Should we be worried about getting the vaccine?
So it depends on the type of reactions, but if you have anaphylaxis, that is one of the questions that will be asked of you when you take the vaccine, and they'll discuss the pros and cons of taking it, and usually they should have access to an EpiPen if you have history of anaphylaxis, and also consider taking that pre-medication of either Benadryl or famotidine to help minimize those side effects.
Mm-hmm. All right, this person's asking, what about those who have had COVID in the last 45 days? Can we safely mix with non-COVID people?
So I think the answer is mentioning, yeah, so when somebody has had COVID and recovered, the thought is that you have proper antibody and you have immunity to future reinfections. We don't know how long your immunity lasts. For some people, we know that it does last greater than 6 months, but we're not sure if somebody that just had very minimal symptoms or no symptoms, do they still have that 6 months immunity? I have a friend of mine that had COVID in April and he still donates blood and he still has detectable antibodies as of last week, and that's, so we hear that a bit. So it is safe for you to be, if somebody's recovered, you do have immunity, but it doesn't like bypass the need. You still should wear a mask because there's other respiratory viruses around, and still do hand washing and being 6 feet apart.
And when you say detectable antibodies, does that mean that your friend would also test positive?
So the blood test for antibodies checks your immunity. And then there are the nasal swabs that looks for the viral particle, and it should not be positive this far out.
Gotcha. Okay. All right, we're going to take a quick break. We've got many questions left in the queue. We want to be able to get them in our next segment. Again, 336-379-5775. We'll be right back.